Mr. Speaker, I rise today to share with you stories of real people and why we need to pass health care reform now. One of my constituents from Boulder, Colorado, John Tizlowski, wrote to me the other day and asked that I share his story on the floor of the House. For 18 months, John has continuously monitored a significant claim for their son. It was denied, which happens all too often, and John called and they reviewed their policy, and they stated over the phone that it was clearly covered. A week later, a denial letter came again. This process repeated itself over and over for 18 months. Every person they spoke with thought it was covered, and still the machine of the insurer kept denying the claim. Finally, John was told that it was too long since their last phone calls, that their calls didn't count as a challenge, and their claim was permanently denied. John had to threaten to sue and had his employer intercede, and guess what? The claim was promptly paid. John guesses from this and other similar experiences what many of us conclude, that insurers routinely deny claims that should be covered. According to John, quote, knowing that few people have the time to follow up so diligently, and each person who gives up and just pays the erroneously denied claim creates greater profit for the insurer. This is an example of why, John writes, we need options that remove the insurer from the picture. We need a public option, or it isn't reform. You know, I held about 22 town hall meetings in the month of August across Colorado. And at many of them I asked, how many of you, raised your hands, have had to battle an insurance company over a denied claim? And at these meetings we had people from the left, people from the right, people from the middle, all across the great ideological spectrum that makes up our great nation. And in every crowd, 80, 90% raised their hands and had borne witness to that battle that John, in his case, successfully fought to have his son's claim paid. Who gets the brunt of not having their claims paid? It's frequently the least empowered among us. John, who's college educated and works with an employer that was willing to stand up for him, was able to get their claim accepted. What if you don't have a high school diploma? What if you're not fluent in the English language? What if you're not aware of your legal rights or ability to use the court system? It is to those who are least among us, who feel the brunt of having their claims denied, and whom the insurance companies assume will not lift a finger to fight back. That is why it's critical that we provide consumers with more choice through creating an exchange that gives each employee of a company, of an employer insured through the exchange, the choice of dozens of companies, including the public option. You know, some people, rightfully or wrongfully, trust private for-profit insurers more than they trust our government. Other Americans trust government more than they trust private insurers. With the public option as a choice, that value judgment, that normative judgment is up to you and no one else. You can choose to trust government or to trust your insurer. In John's case, and many others, they've been fed up with their experience with private for-profit insurers. That's one of the reasons we need to pass health care reform now. Thank you, Mr. Speaker.